Hello. I'm going to speak to you on the universal health care plan that Obama is trying to pass right now. Were you one of the many people that were sucked into Obama's promises and ideas that you agreed with at the time, but now feel differently about? That is what is happening lately with the health care reform, and you're not the only one. This country needs to be politically aware and do their research rather than go off others' opinions and theories. You're not the only one with doubts, and it's not too late to speak out and get what you want and deserve. I'm going to tell you what this plan entails, how it will affect our country negatively, and how it won't be any better than our current situation. When and if this plan is passed, it will take quite some time before it will even become effective, most likely in 2013. That's because, according to Christine Yee, in her essay, Cons to Universal Healthcare, the process to start universal healthcare will be a messy one with countless files, papers, more laws, obviously more taxes, as well as new patient records. You're still going to have to pay medical bills and health insurance, but the government's website on the reform states insurance companies will be prevented from placing annual or lifetime caps on the coverage you receive. Insurance companies will also have to abide by yearly limits on how much they can charge for out-of-pocket expenses. With the passing of this plan, millions of Americans will lose their insurance. A statement from House Minority Leader John Bowe reads, "Americans want lower health care costs, not a $1 trillion government takeover of health care that increases costs and lets Washington bureaucrats make decisions that should be made by doctors and patients. Along with controlling what doctors can and can't do, the government will ration health care, meaning you could be denied a life-saving operation. With the long line of people that will be waiting for medical attention, doctors will have less flexibility to choose hours and work days because their schedules will be controlled. Less people will have the desire to pursue a medical career because of loss of competition, and small clinics and private practices will simply disappear." Well, now, Obama says he refuses to sign a bill that will rack up more debt for our country, but exactly how does he plan to pay for the reform? First of all, there will be unpopular cuts from Medicare, which can leave senior citizens without coverage. FactCheck.org on Newsweek says that Obama has also said he has identified 2/3 of those costs to be paid for by tax dollars that are already being spent right now. Where are they coming from? In the blog, Squashed, you can find columns of the reform, which include the individual mandate. According to the individual mandate, that means people who are without insurance must buy it or take a 2% tax increase. The insurance that is then chosen for them might not even give them the coverage they want. In addition to that, people making over $500,000 or more than $1 million will have a 1% tax increase just because they make more money. As I've told you, this will be very time-consuming and hard to start up. You'll lose your freedom to choose the health care you want, and you'll still be paying for the care without the benefits. The more people that speak against the reform, the more it will be possible that it won't pass. Look past all the benefits and find out what they're hiding, because it sounds too good to be true, and it really is. It's important to pay attention to the fine lines of information behind any major reform or change in society. This healthcare reform is proving to be very controversial while it's causing chaos. It's sugar-coated, and I believe it won't be beneficial because of the poor planning and handling by the government.